Professor, thank you a lot for your excellent speech. The first question that is related to palliative care is that the Slovakia is the country that is aging the most among all of the nations in Europe. How is the situation related to aging in Norway?
I think it's pretty much on the average in Europe. And we are having, I think we are all confronted with the same challenge, that the population grows older. We have known that actually for 20 years. We started to talk about it 25 years ago.
You started to speak about it 25 years ago, and I believe that you probably have started to take necessary steps in order to face this problem. What were those steps?
Well, I don't think we have taken the necessary steps, but we are working on it. And I believe that palliative care, to have that accessible for all patients, is one step. But that's not the only step, but that's one step. And in our country, we have introduced a model for palliative care. In each health region, we have a competence center linked to the university hospital, like in Tromsø, far up north, in the middle part of Norway, in Trondheim, in the western part in Bergen, and in Oslo. And in that center of competence, there are teaching undergraduate, postgraduate in each region, and they're also supporting primary health care, hospital care in each region on how they're going to implement and optimize the structure and the content of palliative care. And then these centers also have clinical competence, so they have inpatient ward for palliative care, they have an outpatient clinic, and they have a home care team. So we have come up with a basic structure which is recommended now, I believe, internationally.
Also, the second problem that is common from all of the countries in the Western civilization is the lack of the workers, lack of the nurses especially, to some extent also the lack of the doctors. How's the current situation regarding the specialization of the doctors or their willingness to become a professional in palliative care?
Okay, so your first issue you are raising, the challenge is access to healthcare providers. And that's something also we knew it would happen 25 years ago, and that it would happen approximately now, and it's happening. So we see also in Norway, even we have enough money to pay people, but we don't have enough people. So it doesn't help with money. So for example, in Oslo, we are still okay, but in all other parts of Norway, it's very difficult to get doctors and nurses.
Especially in the parts that are less urbanized?
Yes. So we are first hit in the northern part, in the western part, in the rural parts. So that's a problem. Then, if you dig into the same challenge for palliative care, what we have been doing is that we have an undergraduate program for medical doctors and nurses to teach palliative care. That doesn't cost any money. It should just be a part of the program. That's something which is regulated by the government and by the Department of Health. Then we are also now, as you have here, a subspecialty for medical doctors. And now it's pretty popular. Now it's just 50% of the people who are applying can get into the program because we don't have enough space. So I think in a way palliative care is pretty popular right now. And for example, if you go to a quite different system, in US, palliative care and palliative medicine is the fastest growing specialty.
Will you say that the current state or the amount of the healthcare providers in the palliative care is currently sufficient, or it should be increased?
Well, I think it's a little bit complex, because I have also been working at the Ministry of Health, where you also need to take economical considerations. And we cannot only scream for more people in palliative care, but we need more people with the right competence in palliative care. Then,
so it should be like a drop-down menu that not all of the competencies should be on doctors and nurses, but we should create also the other professionals?
Yes, I think we need to have, so it's both bottom-up and top-down. So we need, as I said, these centers. I strongly believe in that model, and I will strongly recommend that you do something similar here. But you also need to strengthen the competence for primary healthcare nurses and doctors, general practitioners. So you need to have a combined approach. So I think you need to have a bottom-up and top-down approach at the same time.
Thank you. We have some questions from Slido. How many patient visits does a mobile hospice nurse make per day in Norway?
Oh, that differs quite a lot, because it's related to the distance you have to travel. But I think in average, and it depends about the complexity of the patients, but I think in average, if you know the patient, you can do much in half an hour, 45 minutes consultation at home. So then it depends upon the travel time. So you should be able to have visits to between 4 and 8 patients at home each day, if you have an 8-hour working day.
Which one factor inhibits the development of palliative care?
I think there are many factors, but I can take. Well, if you want to implement palliative care into cancer care, which I've been working primarily on, I think there are resistance within the anti-cancer environment, because it's so much focus on the new drugs, new imaging, new radiotherapy techniques, etc. And that's overwhelming the clinical oncologists. So, but then that might be a barrier. But on the other side, patients, politicians, and policymakers sees that it's well documented that palliative care works. So I think then we need to get help from the policymakers who are demanding that palliative care should be a part of the healthcare system. And I think it should be a human right for the patients that you can die with dignity.
Thank you so much, Professor Stein Kaasa. Thank you.
Thank you.